What's the next step? Once we have the diagnosis, we've taken the time to really better understand what's the problem and exactly where it's located, then we have to take that healing property of the stem cells and the platelets. The first step is usually an easy blood draw where we take the platelets. Those are the cells in your blood that clot your blood. Normally we think of it the ability of platelets to help you not bleed. Platelets normally help the body to clot and to heal. We take those platelets and we concentrate them to a level about 10 times or even 40 times what normally exists in your blood. We do that through a simple blood draw, through a lab processing, and then we inject them again under ultrasound guidance and fluoroscopic guidance to put them in the precise place. Those platelets are full of growth factors and immunostimulants, chemicals that help attract the right cells to do the right job, and one of those cells is the stem cell. Everyone hears about stem cells and their ability to heal anything. That's partly true, but they can't do it without the help and the information from the platelet. The platelets help to, again, release growth factors, tell the stem cells where to come and what to do, how to change into the other tissues that we need to heal. Once platelets are placed in the precise location, they release the chemicals or the cytokines that attract the stem cells to come there. Remember, we have stem cells in our body all the time. They're floating around our body 24 hours a day and finding small injuries here and there and helping to repair them. And they're like little repairmen, but they need a boss. They need somebody to tell them what to do and where to go. And ultimately, when you take platelets in a really concentrated ratio, it's like little espresso shots to those workmen. It keeps them working no matter what. So we will combine platelets and stem cells to do the extra work to help you heal faster, better, stronger. When platelets are used to promote healing and repair injuries, we draw the blood generally that day or just later in the day before we do the procedure. They're processed in the laboratory and then injected within 24 hours to maximize their freshness, if you will. We want them alive and healthy and ready to go. In the case of stem cells, we draw those stem cells the day just before they're processed and injected, because they're particular. They're like the high-end athlete. They want to be catered to a little bit. But they still need the boss. They still need that coach, because stem cells, well, again, they're touchy. They need a coach to tell them how fast to run, how far to run, and exactly what to do. So what we do is we take stem cells, we place them in the right location, or we attract them through platelets, and then we inject platelets behind them in order to tell them what to do. The espresso shot, if you will. What are platelets? Platelets are one of the most important cells in the body. We think of it as the cell that helps us to clot when we get cut, to help us stop bleeding. But in reality, that's one of the small things that they do. Platelets are full of growth factors and immunostimulants. They're actually the boss. They're the guy that tells everybody what to do when an injury's taken place. More importantly, they tell stem cells what to do. We look at stem cells as that cell that can do anything. It's the elite athlete, but they're an athlete without a coach. They don't really know what to do unless they're told. So what happens? The platelets come to a site that's been injured. They actually self-destruct and release the chemicals, the cytokines, the immunostimulants in the area that set up shop. And they tell the immune system to come there and repair this, whatever it is, the tendon, the skin, like when we get cut. And those chemicals actually call the stem cells, and they come to that site, because normally they don't really know where to go, but they know. They hear the call of the platelet, and the platelets then tell them, repair this, fix that. They're like little espresso shots, if you will, to the stem cells to help them do an even better job. We can take your platelets and super concentrate them and actually put them in a site that's been injured and supercharge the healing process, help it to increase the speed in which it happens and do an even better job than your body was doing before.